LASEK, we're the only center in the United States that performs exclusively the non-cutting LASEK procedure. Why is that? Our patients ask that all the time. The reason is 25 years ago, I got LASIK in this eye. I was the first eye doctor in New York City to get LASIK. This is back when I was at Harvard. And back then, it was the beginning of the industry, so we're doing one eye at a time. I decided to do my left eye because it was non-dominant. That means my right eye is the one I use to shoot a gun or play pool. It's the dominant eye. So this is the less important non-dominant eye. The unfortunate part is after I did this eye, the daytime vision was okay, but I had a lot of night glare and dry eyes. It's because of the LASIK procedure itself. So when you do a LASIK, you cut the flap, you lift it up, you laser underneath the flap to get rid of the prescriptions, you put the flap back down. But then the problem is you always have a two-piece cornea. So when the light comes through, you could just imagine there's some scatter across that flap interface. That causes the night glare. And then dry eyes is because when you cut the flap, you cut the corneal nerves, it causes dry eyes. So everybody who has to get LASIK, they have some dry eyes afterwards. It's hard to know how much they're going to have. If you have dry eyes to begin with, you really shouldn't get LASIK because it's going to make your eyes more dry. So that's why I decided not to do my dominant eye because I had dry eyes and night glare after I did the LASIK. That's actually when I switched this practice from LASIK to LASIK. So LASIK, the non-cutting procedure, the recovery takes longer. This side took 1 or 2 days. This side was like 3 or 4 days, but I avoided the dry eyes and night glare. So if anyone out there is really concerned about safety, you have to do the non-cutting procedure. It is safer. I did a CME, continuing medical education talk at Harvard about refractive surgery. There were about 100 ophthalmologists, and I said, if you were going to do your own eye or a family member's, which would you choose? Almost all of them actually choose the non-cutting LASIK or PRK. PRK is an older method of doing that. We're going to get into that in another video. What's the difference between PRK and LASIK, okay? But anyway, you got to understand, these are 100 ophthalmologists who said if they had it done themselves, they would go with the safer procedure, even though it's a slightly slower recovery. Also, you have to understand that if I get punched in the eye here or just poked in the eye, the flap could come up and then I'm screwed because I won't see well for the rest of my life. If I get punched in this side, that can't happen because there was no flap to begin with. So anyone who does martial arts, contact sports, kickboxing, boxing, extreme sports, they really shouldn't do the LASIK procedure. It's only safe to do the non-cutting procedure. Extreme special forces people like Navy SEALs, that kind of stuff. I've done a bunch of Navy SEALs. They're not actually allowed to get LASIK because if the flap comes off during the mission, it's like destroyed, mission critical, done. This one, it can't happen. So anyone out there who's concerned about safety, they really have to do a non-cutting procedure. And in the next video, I'll talk about why I don't do PRK anymore. So the recovery is longer, but the final outcome is better. All our patients are choosing a longer recovery for better final outcomes. Thank you.